Hi, I'm Doc July, and this is how I remember the ACR-ULAR classification criteria for rheumatoid arthritis. Take note that this is a classification criteria and not a diagnostic criteria. This table summarizes the classification criteria. The major components are joint involvement, serology, acute phase reactants, and duration of symptoms. It is helpful to understand that rheumatoid arthritis is a chronic inflammatory autoimmune arthritis. Each of these words represents a component of the criteria. The word chronic is represented by the duration of symptoms. 1 point is given if the duration of symptoms is equal or more than 6 weeks. Rheumatoid arthritis is an inflammatory arthritis. 1 point is given if there is abnormal CRP or abnormal ESR, which are acute phase reactants. Serology is performed for autoantibodies. In rheumatoid arthritis, ACPA or anti-citrullinated protein or peptide antibody is elevated with high specificity, and clinically, anti-CCP or cyclic citrullinated peptide antibody is widely used for diagnosis of RA. Rheumatoid factor or RF could also be used. Negative means less than or equal to the upper limit of normal. Low positive means more than the upper limit of normal, and high positive means more than 3 times the upper limit of normal. And since this is an arthritis, one of the components is joint involvement. Take note though that in RA, there are also extra-articular involvements. Before we proceed with the mnemonic, keep in mind that the use of this classification criteria has two requirements. The classification as definite RA is based upon the presence of synovitis in at least one joint and the absence of an alternative diagnosis that better explains the synovitis, such as lupus, psoriatic arthritis, or gout. The maximum number of points possible is 10. A classification of definitive RA requires a score of 6 over 10 or higher. Patients with a score lower than 6 over 10 should be reassessed over time. It appears that the number 6 is significant in rheumatoid arthritis. For definitive arthritis, it requires a score of more than or equal to 6, and for the duration of symptoms, a score of 1 is awarded if the symptoms has occurred for more than or equal to 6 weeks. Lastly, subjects with typical bone erosion can be classified as having RA regardless of the score. The mnemonic that I use is SAD joint. S is for serology. In this case, we could use the rheumatoid factor or the anti-CCP antibodies. A is for the acute phase reactants, ESR or CRP. D stands for duration of symptoms. And lastly, joint for joint involvement. To summarize, RA is a chronic inflammatory autoimmune arthritis. The mnemonic that I use is SAD joints. S for serology, A for acute phase reactants, D for duration, and joint for joint involvement. Please subscribe to my YouTube channel, Memory Aid Medicine. Thank you.